Great. Thank you. A quorum is present. Do we need remote participation?
We do not require remote participation.
Great. Okay, the chair will entertain, are there any changes to the agenda?
No changes for your agenda.
Okay, and public speakers?
We do have a number of public speakers. I'm going to call your name. If you are in the room, please come to the mic. Eva Marie Duff, Taiwan Sims, followed by George Blakemore, and then we have virtual speakers. So Eva Marie, if you're here, please come. Taiwan Sims, I don't see him present, and then George Blakemore. Tell us your name and please begin.
Good afternoon. My name is Eva Marie Duff. I am the VFW Illinois District 4 Commander, and I am also Veterans Assistance Commission of Cook County at-large board member. Good morning, everyone. Across this county, outreach efforts are expanding and reaching veterans who previously had no connection to services. This outreach is working. Veterans are coming forward and asking for help and trusting the system that has been created to support them. But with that success comes clear reality that we have a demand for services that is growing. One of the most significant changes we are seeing in this rapid growth is in the women veteran population. Along with that growth, we are seeing an alarming rise in women veterans facing housing instability and homelessness. This is not a future problem. This is happening right now in our communities. When outreach identifies veterans in crisis, we must have the resources available to respond. Without the proper funding and support structure, we risk identifying problems without having the capacity to solve them. Strengthening the budget and resources available to our Veterans Assistance Commission is not simply about expanding the programs. It's about ensuring the veterans of Cook County receive timely assistance, stable housing support, and access to services they earned through their services to this country. At this time, increased investment must always come with strong accountability. The Commission has the responsibility to ensure that every dollar used transparently, responsibly, and directly in support of veterans. The veterans of Cook County have stepped forward to serve when the nation asked. It is now our responsibility to ensure that the systems designated to support them are strong enough to meet this obligation. Because when a veteran reaches out for help, the answer should never be the system does not have the capacity to respond. Thank you very much.
Thank you.
It was good morning, but good afternoon, Madam Chair and Commissioners. I'd like to begin with an issue that affects veterans across the entire state.
And tell us your name again, sir.
And I'll try to simplify what is at stake.
State your name.
Dutch DeGroot.
Thank you.
Okay. Recently, a bill was introduced that would have effectively dismantled the veterans commissions all across the state, harming tens of thousands of veterans and reducing the flow of federal dollars coming into our state. While we understand it may be in process of being withdrawn, we must recognize that proposals like this can and likely will resurface. At the center of the issue is the Military Veterans Assistance Act, which clearly outlines how VACs are funded. It allows, excluding Cook County, up to 0.02% of the tax levy to be allocated. This is a cap and not a mandate. Claims that another proposal would raise this to 0.03% are simply totally false. Equally concerning, no VAC or veterans organization was consulted in the process of this bill, undermining the very transparency that was being claimed. The law is also clear. The supervisor of general assistance or the county board shall provide such sums of money as must be just and necessary. That means funding should be based on real need and justified budgets, not arbitrary limits or political pressure. We are aware that certain anti-veteran lobbying efforts, along with leadership in some counties, are driving these proposals. At the same time, costly mandates and legal disputes are emergency. Many of them could be avoided through basic communication. Instead, taxpayer dollars are being spent on attorneys, and in some cases, counties are funding the very lobbyists who help create these problems. VACs already operate with accountabilities. Budgets must be justified. They are reviewed by both the governing veterans organizations and county boards. We are taxpayers as well, and we take seriously our duty to safeguard public funds and public trust. When those budgets are justified, counties should fund them accordingly. There should not be a system of dictation, it should be one of partnership. Veterans are your constituents, and like you, taxpayers, the shared goal must be to serve those who serve. Because of our collective advocacy last year, excluding Cook County, nearly $180 million flowed into Illinois. We brought that in. VACs are among the only entities that effectively pay for themselves through benefits that they bring to our communities. The decisions made in this room resonate in this room throughout the state. We ask you to lead to ensure that legislation like this does not move forward again. The Illinois Associated County Veterans Assistance Commission stands ready to assist and mediate, but meaningful progress requires open communication. Turning to the Veterans Assistance Commission in Cook County, our report is transparent, that you'll hear it, and I want to commend county leadership for recent efforts to improve relations and remove obstacles that were hindering our work. That said, challenges remain. Routine processes like acquiring basic software can take 6 to 8 months to be done. In one case, I'm personally paying for email service out of my own pocket. We also remain understaffed and cannot keep pace with demand. Even our original modest budget fell short by roughly 25%. I respectfully ask that we continue progress we've made and commit improving at every opportunity. It is always my privilege to address this body on behalf of veterans and their families. I thank you.
Our next speaker is Rita Sims, followed by Frank Gutierrez. They are Rita Sims, Frank Gutierrez. If not, ma'am, no response. That does conclude our speakers. And sorry for the presentation was up, so those on Teams could not see the public speakers, but we are done, I believe. So one more time, Rita Sims and Frank Gutierrez. And then Taiwan Sims did not respond. Ma'am, we are done.
Okay, thank you. The chair will now entertain a motion from Commissioner Aguilar to approve item number 261055, the minutes from the meeting of May, seconded by Commissioner Daly. All in favor of approving item 261055 signify by saying aye. All opposed say nay. The ayes have it. The motion has passed. The next item on the agenda is to receive and file item number 261013. Commissioner Daly, could you move that, and second it by Commissioner Lowry? And I'd like to call on Superintendent Soto of the VACC to give an overview of this report. Thank you.
Thank you very much and good afternoon. My name is Elizabeth Soto and I have the great privilege of serving as the Superintendent of the Veterans Assistance Commission of Cook County. And it is an honor today to present to you the VAC's FY26 first quarter report. Today, the VAC team and I will walk you through our mission in action that highlights the direct impact we've made this first quarter, the services we delivered, and the continued growth of our programs to better serve our veterans across Cook County. So here's a brief overview of today's presentation. We will begin with our mission, followed by a detailed look at our emergency services and financials. We will then move into our Veteran Service Officer operations and conclude with our outreach efforts. Each section will not only reflect what we do, but how we are continuously improving access, efficiency, and impacting the veteran community. So before we get into our report, I always like to take a moment to review the core of everything we do through our statutory mission, which is for the just, necessary, and needed assistance and services of military veterans who serve in the armed forces of the United States. This language is our directive and mission per the MVAA, which guides our VAC's every decision, program, and very meaningful interaction we have with our Cook County veterans and their families. One of these programs is emergency services, which continues to be a very critical component of our operations. This is where we meet veterans in moments of immediate need and when their stability is at risk and timely intervention is essential. In FY26, our emergency financial services continue to focus on core areas of need, which included rent and mortgage assistance, utility support, and transportation-related assistance. These services are designed to stabilize households and prevent crises before they escalate. And I would like to note that our gas and work attire programs were recently evaluated, and we have found that there is not as grave a need as we originally anticipated, and so we have shifted resources to other areas of greater need within the veteran community. Well, in addition to housing and utilities, we also provide support for essential daily living needs. This includes food, hygiene assistance, and burial and funeral support. Now, turning to our FY26 first quarter financials, December through February. During the first quarter, the VAC distributed a total of $273,892.43 in direct emergency financial assistance. This is roughly an average of about $90,000 per month in essential support directly provided to our veterans facing significant financial challenges in these high-cost times. At this rate of disbursement, it is notable that the VAC is poised to exceed $1 million in total direct financial assistance by the close of this fiscal year. This will represent an increase of approximately 28% over the $849,000 provided at the end and close of FY25. The top three areas of financial assistance provided were rental assistance at $56,835.81, food assistance at $50,800, and burial and funeral assistance at $57,330.17. In total, this emergency financial assistance supported 907 Cook County veterans, which included 150 individuals who were new to the VAC entirely. During the same period, the VAC also handled more than 1,853 phone calls, and we would now like to hand the floor over to Christina, who is the manager of our Veteran Service Officer program, to Mr. Derek Giffen, who is the manager of our Veteran Service Officer program at 1100 South Hamilton Avenue.
Good afternoon. This slide represents our fiscal year 2025 operational impact. 976 total claim actions. Good afternoon. This slide represents our fiscal year 2025 operational impact. 976 total claim actions were completed on behalf of veterans in Cook County. That includes 388 powers of attorney, 248 intents to file, and 198 new disability claims, in addition to 142 appeals and higher level reviews. These are not just numbers. Each one represents a veteran connected to benefits, access, and support. This entire output was produced with only 2 VSOs who had access to VA systems and 1 additional staff member still pending access. We operated with a single primary access point into these systems for the lion's share of fiscal year 2025. So while the results are strong, this is not full capacity, this is constrained capacity. The demand is already proven, veterans are coming to us, outreach is working, trust in our organization is growing. But our ability to respond is limited by staffing and system access. If we expand accredited VSO staffing and increase access points, output will scale immediately and significantly. This means more claims filed faster, more timely support for veterans, and more federal benefit dollars returned to Cook County. So from an executive standpoint, the takeaway is clear. This is a high-performing model operating under limitation, not at scale. With the right investment in capacity, we can significantly expand both access and impact. This slide highlights our Q1 operational activity and direct financial impact for veterans in Cook County. In just this quarter, we achieved 319 powers of attorney, 294 intents to file, 203 new disability claims, and 147 appeals and higher level reviews. That's over 900 claim actions initiated in a single quarter. This level of output was produced by only 2 VSOs with access to VA systems, 2 people. And they were not just processing claims, they were operating under NAC VSO accreditation standards, which require full claim development, evidence review and strategy, veteran counseling and expectation setting, accuracy and compliance with VA regulations. This is not administrative work, this is skilled, regulated representation, which means every single action you see here was done thoroughly, correctly, and in alignment with national VSO standards. Now, let's look at the financial impact. For December of Q1, we had $91,889. January was $97,960, and February was $121,949. That's a Q1 total of over $311,000 directly delivered to veterans. And more importantly, over $9.3 million annually is currently being paid to Cook County veterans, represented by the Veterans Assistance Commission of Cook County. 2 VSOs generated over 900 claim actions and contributed to millions in benefits delivery. That tells us 2 things. The demand is there and the model works, but it also highlights the gap. We are operating at maximum effort, not maximum capacity. These results required pushing workload limits, prioritizing cases carefully, and in some instances, delaying how quickly we could serve every veteran. With just 2 accredited VSOs, we are producing over 900 claim actions per quarter. To reiterate, delivering more than $9.3 million annually to Cook County veterans. But this is being done under constraint, limited staff, limited system access, and operating at full workload capacity. Now on the right is a conservative projection. With 5 VSOs, we would scale to over 9,000 claim actions annually and more than $23 million in annual compensation delivered. That is more than double the impact without changing the model. Because the demand already exists, the outreach is already working. The only limiting factor is capacity. So I'm going to turn the latter half of this presentation over to the other VSO manager, Justina Berry. Thank you.
Good day, everybody. My name is Justina Berry. I am a VSO manager. I will provide a quick update on our VSO operational access and staffing progression, which directly ties into our ability to serve our Cook County veterans. Starting with operational access, both myself and Derek Giffen have full access to VA systems. That means that we are fully credentialed. We are operating under the National Association of County Veteran Service Officer accrediting standard, and we are actively representing veterans through the full claims process, from intake to submission to evidence development and of course to appeals. We are functioning at full operational capability with our staff. Now on training and expansion, our VSO's Ferris Karadash, he has completed the National County Veteran Service Officer Basic Benefits course. He's also completed the VA trip training, and he's currently in the process of obtaining access to all VA systems to better assist our veterans. Once this system is accessed from the Department of Veterans Affairs, Ferris will become fully operational, and he'll be able to submit claims, develop evidence, represent clients with their appeals, and provide direct benefit counseling. So what this means from an operational standpoint is we are actively expanding capacity, and we're not starting off at zero. Every VSO we bring on will have full access and will directly increase our ability to deliver these results. As Derek previously mentioned, we already demonstrated what 2 fully operational VSOs can do. The next phase is scaling that impact by bringing in additional VSOs, expanding their system access, and increasing service availability across the county. We're not building capability, but we are simply activating it. And as access expands, so does our impact. Next, I really want to highlight one of our most important initiatives, which is the Military Sexual Trauma Claims Clinics that was launched in December of 2025. This program is led by myself as the Women's MST Coordinator and Derek Giffen as the Male MST Coordinator. At its core, this initiative is about access, trust, and removing barriers.
Okay, I'll take care of it, okay.
We know that many veterans impacted by military sexual trauma do not report their experiences in service. They face significant challenges navigating the claims process and often delay or avoid seeking benefits and care altogether. So this program was designed to meet those veterans where they are. What we are doing that's different is that we provide the trauma-informed, one-on-one claims assistance in a confidential and supportive environment. Currently, the physical location of these claims clinics is at 69 West Washington, Suite 1420. But in order to reach all of our veterans, we also offer virtual options so that we definitely meet the veterans where they are on their time schedule also. So again, this is not a standard outreach event. This is a specialized, structured access point for a highly vulnerable population of veterans. Also, from an operational standpoint, these clinics reduce barriers to entry, they increase access to VA benefits, they strengthen connection to VA healthcare, and they support long-term stability for our veterans. We are reaching veterans who may never come forward otherwise, and we're helping them take the first step. So now I will pass the mic to Counter Interest to talk about.
Well, all I can say, hey, Vicky, simmer down a little bit. We got the DD 214, right? We came through. We give you an avenue to go to. You can go to.
Good afternoon, everyone. I'm Connor Interest, Communications and Outreach Manager for the Veterans Assistance Commission of Cook County. To begin, some of you who might not be familiar, at least with our outreach program, it's pretty simple. Our responsibility is to try and reach veterans both through physical outreach, marketing materials, or online presence to bring them through the doors either to talk to our VSOs or to receive emergency financial services, or if necessary, connecting with partners across Cook County to help them with a myriad of other services that we may not provide ourselves. Now, just to dive into it, we want to kind of reiterate what we did in FY25. Our metrics are broken down as follows. We conducted at least 200 outreach events across Cook County, assisting directly 899 veterans and interacting with almost 3,200 veterans. To clarify what that means, 899 of these veterans we provided direct assistance to through connecting with our VSOs, our EFS, or our partner resources. But there were some events where we didn't manage to interact with every single veteran, so 50 may have attended, but we directly assisted 10. So we do marketing events in that aspect. And for the 200 outreach events that we conducted, it was handled by just 2 outreach staff with some assistance from the VSOs when we were short to be able to at least fill in the gaps. But with that, that is just a snapshot of what we did in FY25. So to break down how we focus on strategic objectives, we generally do data analysis. We conduct traditional outreach out in the field. We also conduct online marketing, social media interaction to try and at least hit a wide swath or cast a wide net across the community. But the focus here is to try and also just expand access to veterans from all generation all generational access in this case. Older veterans who may prefer more interaction in person to younger veterans who are working with families who may have little time to really interact with us. We do whatever we can to ensure that everyone is reached to try to get the services that they are in this process. Just as a snapshot of Q1, so we'll use Q4 as an comparison from previous year along with what we're currently doing. So this quarter, after 3 months, we conducted at least 85 outreach events, 42 of them being Vet Connect, 32 being Resource, 1 Vet Talk, and 10 ceremonial events. Previously, we had 67 outreach events conducted in the previous quarter with 30 events attended, office hours at least for 37. With the breakdown in regards to the numbers, those we assisted directly were at least 282 for this quarter, with total interactions being 695. Previous quarter was 482 directly assisted, with at least over 1,000 that we were interacting with. To clarify a point here, the majority of our events that we conducted this quarter were mostly office hours or Vet Connect events directly working with our partners, elected officials. What that would look like is generally veterans coming into those locations to talk to us directly. It's not the traditional resource fair, which previously we conducted far more resource fairs and larger events that we would see a lot more veterans interactions in that capacity. But that's just a clarification, at least why the numbers are different between these two quarters here. Just a breakdown of at least our metrics and data here. So one thing that we initiated last year was kind of a QR code tracking. So basically we've created multiple different QR codes for many different forms and services that we offer, whether it's connecting with our social media, our intake form, generally with our website, and we kind of splattered across all of our marketing material. Every time someone scans that QR code, we're able to see in what part of the county that scan was made, so that we can track our outreach efforts to see where the majority of these requests are occurring, so that we can see if we need to bring in outreach services to those locations. But this is just kind of a breakdown. Over the time that we've conducted this program, we've had at least over 1,000 unique scans, with over at least 418 going to the webpage, 382 going over to our social media, and then 131 going to our main website. This is the data breakdown of our intake form. So last year we actually developed an intake form which allows veterans to actually request services, not just directly with us, but with our partners. And we've modified it quite extensively over the past few months to try and create more automated systems so that they can get those direct assistance as quickly as possible from us and our partners. Any requests for our office, like emergency financial services or VSO services, they're directly contacted by our team. Anything that is a partner-related request, say mental health, car repair, or something that is outside of our purview, we direct them towards partners. Usually just automating the email to those partners who then follow up with that veteran so that they get those services in an efficient and effective manner. We're still modifying this, growing this, and developing this, and we'll be rolling out a new intake form here within the next quarter or so to try and improve that system and automation that we're integrating into it. But right now, this is a snapshot of this. We've had at least 641, is at least the end of Q1. We've had some more, at least for Q2 already, we're not noting here. 641 veterans we've directly assisted, with over 2,600 unique requests for each veteran. So a veteran might request several different things on the intake form, which we track those individual requests. This is a breakdown in regards to Q1 of last year and then, or excuse me, Q4 of last year and Q1 of this year. So as you can see, a lot of our outreach events were kind of scattered across Cook County, but we had taken a focus on trying to get more into the south side as well, since that, per our data, shows a lot of the veterans living down in locale seem to be underserved. So with that, we've worked with many elected officials as well as with different municipalities and different VFW Legion posts down there to try and bring those services more effectively out to those communities. And we've seen at least a massive increase, and a lot of veterans have been using that service. With that in mind, again, I would like to reiterate, this is even more events conducted in this quarter than we did the previous quarter. And again, this is being handled by 2 outreach coordinators, basically myself and Julian as well. With that in mind, the spread has been a little bit more evenly provided across the community, as you can note here. So the objectives for our next quarter are twofold, specifically, or 3 in this case if I want to expand on it. First is to try and reorganize our website. So the website we've been using have been has been fantastic for the past couple of years that we have used it. It has served its purpose in providing at least connections for veterans to understand how our organization works, including meet the legal obligations of the state to ensure that we are being as transparent as possible about all the information that we as a commission and as an office are really conducting. With that in mind, with us integrating new forms, new systems, new tracking data, new marketing materials, we want to make it more accessible and usable by veterans so that they can go on there, use our intake form effectively, connect it with our partner resources, be able to see what our office does in an efficient and effective manner, make it more user-friendly. With that, that is one of the main goals we have for this quarter, is to try and restructure that internally. The second portion would be for more or less integrating the Power App system into our office. So currently, right now, a lot of the tracking is somewhat rudimentary in regards to how many veterans we interact with. For example, if I go to an event and I interact with 5 veterans, I would have to basically handwrite in like the names, information, tracking data to be able to track how many veterans I directly assisted at that location. And usually it's easier for us to provide just hard numbers in regards to that. But with the new Power App system we're integrating, we would be able to see, one, what veteran or who the veteran is that we directly assist and how many times that veteran had used the services in our office, not just from outreach, but as the VSOs and our emergency financial services. So we can track that data more effectively, and if we were audited, we could show exactly how we were assisting the veterans and having actual data to show that more effectively in this context. Right. With that in mind, we're always going to be continuing to expand our outreach efforts and our operations. As you've been seeing from previous years, we started when I first started here as an outreach, we were probably averaging maybe 36 outreach events a quarter. Now we've been averaging at least 40 events each month. And with that, we've been constantly expanding and improving the system. And we'll continue to do so. With that in mind, I'll save any questions for the end, and I'll hand it back to our superintendent for further conversation.
Well, thank you. That is our report.
Okay, thank you for those updates. It sounds great. Any questions from any commissioners? Commissioner Lowry.
Thank you, Chair. I don't have questions. I just want to thank you for a very comprehensive report. Thank you for your good work.
Thank you. Commissioner Aguilar.
I just want to thank you, and I want to thank Elizabeth Soda for her quick response to my district's veterans, and also want to welcome and all the veterans that are here. And we're very honored of your presence here, so thank you very much, and thank you for your service.
Thank you. Any other questions? No, that's great. Well, and I just want to say thank you all for the work that you're doing too. I mean, we've definitely seen an increase, and thank you for your leadership. And I just want to give a shout out to my staff too for our veteran outreaches that we've had. Thank you to Sam, who's been putting those together across the 6th district. And this came up, so thank you all for your updates. Okay. So hearing no further discussion, all in favor of the motion to receive and file item 26-1013, signify by saying aye.
Aye.
All opposed say nay. In opinion of the chair, the ayes have it. This motion is approved. Commissioner Lowry moves to adjourn, seconded by Commissioner Aguilar. All in favor of adjournment say aye.
Aye.
All opposed say nay. The ayes have it. The motion carries, and this meeting is adjourned. Thank you.
Thank you.
Thank you, Commissioner Morrison. Will you please call technology?